Welcome to the Clinical Podcast Series brought to you by the American Academy of Optometry Foundation. Today's episode is entitled Clinical Characteristics and Etiology of Acute Acquired Comitant Esotropia. It is my pleasure to welcome our host today, Dr. April Jasper, our topical expert and editor, Dr. Plaumann. And now it's my pleasure to bring you today's episode.
Hi, everyone. I'm April Jasper, and I'm speaking today with our topical editor, Plaumann. Mo completed her OD training at the Southern California College of Optometry and is currently finishing up her PhD training at The Ohio State University. She is also a fellow of the American Academy of Optometry. Today, she will be discussing the March 2022 Clinical and Experimental Optometry paper entitled Clinical Characteristics and Etiology of Acute Acquired Comitant Esotropia by Meng et al. All right, you ready, Mo?
I'm ready.
So let's start at the very beginning with the basics. How were the patients identified for the study?
So this paper was particularly interesting to me because I feel like the acute acquired comitant esotropia, or AACE, is something that's been talked about a lot recently in the pandemic, with everyone being on their smart devices or doing a lot of near work. But interestingly, this group comes from a pre-pandemic time period. The last patient was seen in the fall of 2019, and they were all identified from a chart review of a hospital-based clinic. They looked over their records for about a 1.5 year range, and they found 51 patients with this condition. They all presented with diplopia, acute onset. They had to have 20/20 visual acuity in each eye to be considered, right? We're not looking for any kind of amblyopia where there's maybe a decompensated strabismus, and then they had to have no other abnormal eye movements, and then to have been followed up by the clinic for at least 4 months to be considered for the discussion.
So what were the general characteristics of the patients?
So the age range was from 8 years old to 55 years old, but on average, everyone was at 24 years old was the average, and it was kind of tightly clustered around that like young adult age. The majority of them were myopic. There were about 15% of them who were hyperopic, but that was only about 1 diopter of hyperopia. About half of the population of patients were students, and the majority of others were a near work intensive occupation. So kind of like I was chatting about a little bit earlier, with a lot of near work, we think that that's associated with the onset of AACE, and the average amount of near work reported daily from this group was 9 hours a day. And then the average magnitude of deviation was 20 prism diopters at near, 25 prism diopters at distance, but quite a few, about 20% of them, had a 50 diopter or bigger ET at distance or near. So it could be quite a large angle.
You said they were followed up. So what kind of care did they receive or treatment in the study?
Yeah. So at baseline, or when they presented, everyone had a dilated encycloplegic exam. There were fundus photos. And then everyone also received either a CT or MRI, so some kind of brain scan. And the brain scans identified 2 patients with brain tumors and 1 with a Chiari malformation. And interestingly, too, these were pretty much the 3 really pediatric patients in the population. These were like the 8 and 9-year-olds. So that was found. And then as far as then treatment otherwise for the people with normal brains and just an acute acquired ET, 2 patients just wanted observation, and they had their diplopia resolved, but they both switched jobs, and that kind of resolved their complaints. 10 patients went through prism therapy, prism put into glasses, and diplopia resolved in all those cases. 15 patients had Botox, and a majority of them had resolution of symptoms, but 2 had lingering diplopia, and it was associated with a residual ET that the Botox didn't completely resolve. There were 21 patients who had strabismus surgery, and for all of them, diplopia resolved. And then the 3 patients with the different brain abnormalities. They noted that all 3 patients underwent some kind of brain surgery, and 2 of them still had persistent diplopia, presumably from still some kind of ET that maybe hadn't been addressed at the time.
Wow. So how would we take this one and apply it to clinical practice?
I will say, first and foremost, reading this paper, I was like, brain scans for all of my patients with acute acquired comitant esotropia would be indicated. I think with acute acquisition, most of us are kind of leaning that way. But I know when I'm thinking about, if it's a comitant deviation, it makes me feel better that it's likely to not have, brain involvement. But I think, good to send everyone, and then especially those young cases being where it was really found. I think that's important to keep in mind. I also, thought it was interesting that there was some resolution of symptoms seen without intervention, those 2 people who switched jobs, but there's not really much about whether the ET itself resolved or not. And I also don't know that it's really practical that I would just tell my patient, just stop what you're doing and you'll be fine, most likely, right? I mean, people have to do what they want to do with their eyes. So I was thinking that's something good to kind of keep in mind.
Yeah.
And then lastly, I thought it was great that, diplopia resolved for a lot of people. So prism and potentially vision therapy for some of those smaller angles, I think is a good idea. And then referring for the larger angles, a surgical consult, just to get these people fused again and comfortable.
Wow, I love it. This one at first, I didn't quite know how we were going to take this one for how to utilize it in clinical practice, but you're absolutely right. There's so much to learn, and that is the beauty of research. I think it's fabulous. Mo, thank you. It's a joy to be on these with you. I learned so much. I know everybody does that's listening.
Thanks, April.
And a special thanks to Cooper Vision for their educational grant to make it all happen.